Are you experiencing unexplained muscle pain and stiffness, especially in the morning? It could be polymyalgia rheumatica. But don't worry, today we'll break it down and explore how to manage it. Hello, this is Dr. Siddharth Damber from Chicago Arthritis and Regenerative Medicine. I specialize in non-surgical treatments for musculoskeletal conditions, rheumatology, regenerative medicine, and metabolic health. My goal is to help you live pain-free and optimize your health with cutting-edge treatments. Today we're diving into an important condition that you may experience but may not fully understand: polymyalgia rheumatica, or PMR. It's a disease that causes muscle pain and stiffness, especially in the shoulders, hips, and neck. If you're struggling with these symptoms, or if you're worried about what could be causing them, this video is for you. Understanding PMR is important because while it can be uncomfortable, there are effective ways to manage it and live well. So let's break down what polymyalgia rheumatica really is, the symptoms to watch out for, what causes it, and the best ways to treat it. So what is polymyalgia rheumatica, or PMR? PMR is an inflammatory condition that mainly affects older adults, typically over the age of 50. It causes pain and stiffness in the muscles, especially around the shoulders, hips, and neck. This isn't just regular muscle soreness, however. PMR can make it hard to move or even get out of bed in the morning. Unlike other types of arthritis, PMR does not classically or typically affect the joints, but the muscles around them. The stiffness and discomfort can be so intense that it impacts daily activities like getting dressed or reaching for something on a shelf. Here's where things get tricky. PMR can mimic other conditions, so many people don't realize they have it at first. Some common symptoms include morning stiffness. You may feel a tremendous amount of tightness or pain, especially when you wake up. This will typically last more than 1 hour and frequently the entire day. Muscle pain. The pain is often felt in the shoulders, upper arms, hips, and thighs. Limited movement. The stiffness can make simple tasks like brushing your hair or walking upstairs much harder. Fatigue. You may feel unusually tired or weak, even if you've had plenty of rest. Fever or weight loss. In some cases, people with PMR may experience mild fevers or significant unexplained weight loss. So let me ask you, do you wake up feeling like you can barely move, or does it take hours to improve as the day goes on? That's a potentially classic sign of PMR. Now let's talk about what causes PMR. The exact cause of PMR is not fully understood, but we do know it involves an immune system response. Essentially, your immune system mistakenly attacks your muscles, causing inflammation. Some people are more likely to develop PMR due to their genetic makeup, while others may have certain environmental factors that can trigger it, such as infections or even stress. It's also more common in individuals of Northern European descent and those over 50 years old. Diagnosing PMR can be tricky because its symptoms overlap with other conditions. To get a proper diagnosis, doctors typically rely on a combination of a proper history, examination, blood tests, and imaging. Blood tests to check for inflammation markers like SED rate or CRP are typically elevated. A physical examination to assess your range of motion and tenderness in specific muscle groups. In addition, there are certain classic findings in rheumatoid arthritis will differentiate it on examination compared to PMR. Excluding other conditions through lab testing and imaging to rule out diseases like rheumatoid arthritis or autoimmune diseases is important. The reason why is because while there is significant overlap in how these conditions present, their prognosis and treatment protocols are very different. Here's the good news. PMR typically lasts 6 months and it can be managed very effectively with treatment. The goal of treatment is to reduce inflammation and relieve symptoms so you can get back to doing the things you love. The most common treatment for PMR is a low dose of prednisone or corticosteroids. This helps to reduce inflammation quickly, even within the first day or two in some cases. But it's important to use it carefully because long-term use can cause side effects. Non-steroidal anti-inflammatory drugs, or NSAIDs, these can be used to help with pain relief and inflammation, but they're usually not as powerful as steroids. Physical therapy. As your inflammation improves, gentle stretching and strengthening exercises can help to restore movement and reduce stiffness. And lifestyle adjustments. Staying active, eating an anti-inflammatory diet, and managing stress can also support your healing process. Most people with PMR will be on a slowly tapering dose of prednisone for 3 to 6 months, after which your condition typically resolves permanently. A small number of patients will have continued inflammation and will need to start a disease-modifying drug such as methotrexate long-term. Again, the reason for that is because if you are going from a condition that is only lasting from 6 months to now a condition that may be longer term, using steroids much longer than that can be risky. And adjusting and then adapting to a lower risk treatment that you can utilize longer term is appropriate at that time. A rare complication of PMR is called temporal arteritis, where the blood vessels get inflamed and can threaten vision loss and cause aortic aneurysms. While rare, if these complications occur, and these are very severe complications, you'll typically require stronger and longer treatment will be needed. Polymyalgia rheumatica can be a tough condition to deal with, but with the right treatment plan, most people can experience significant relief and live an active, fulfilling life. The key is getting a proper diagnosis and following a treatment plan that works best for your body. Remember, early diagnosis and treatment are crucial here to prevent complications and improve your quality of life. If you found this video helpful, please like, subscribe, and hit the notification bell so you don't miss out on more content like this. For personalized care and expert advice on managing musculoskeletal conditions like PMR, visit us at chicagoarthritis.com. Take the next step towards feeling better today, and until we connect again, I hope you stay healthy and live well. Bye-bye.